Hello, everybody, and welcome. I'm sure we still have a few people joining us, but it's time for us to get started. My name is Tim Kelley. I'm an executive director here at athenahealth, and I want to welcome everyone for coming to our presentation today here. And if I can advance the slides, that would probably help. Hey, Nikki, I'm not able to advance the slide. Thank you. All right. So today you're all here. Everyone on the phone here is an athenaPractice customer, and you're all here because you want to learn a little bit more about athenaOne. Some of you are at different phases of that, journey, if you will. Some of you have just started it. Some of you are further away down the road, et cetera, et cetera. So we're going to take about, I'll walk you through the agenda in just one second here. But first, the first thing I want to do is, again, welcome you. Thank you for taking your time to be with us. But actually, really the most important thing is to thank you all for being customers. You've all been customers for a number of years, and we really appreciate that. And as you look at this potential move, we want you to know the most important thing for us is we want to help. We want you to remain a customer, whether it's on athenaPractice or whether you make the decision to move to athenaOne. Thank you. So here's what we're going to cover today. So I'm going to kick us off with just a little sort of table setting, if you will, on athenaOne. And then we're going to get into really the heart of the matter. What I think most of you are here for is to hear from some of our customers. So I'll turn things over to Ken Getz, who's our VP of Customer Success. And he's got Megan Carrick from Virginia Urology and Kaylee Meadows from Anderson Hills Pediatrics. And they are both athenaOne customers who converted over from athenaPractice. So you're going to get to hear sort of the story from them about how they made the decision, how they went through the onboarding, what it's been like since then, et cetera, et cetera. So be about 45 minutes of that. You'll get to really hear from them about their experiences. For those who want to stay for a little bit longer after that, we're going to do a demo scheduled for about 30 minutes afterwards. So hopefully everybody wants to stay, but if you can't, we certainly understand. Can you move to the next one, Nikki? Thanks. So also we're taking questions throughout. So a couple things. As we're going through all this process, if you have a question and you want to just hit that Q&A button, and you can post your question in there, and we'll take a look at it behind the scenes and try to work it into the equation. When we get towards the end of the presentation, the conversation with our customers, we'll have the opportunity for you also to ask some questions, and also during the demo, be able to use that raise hand feature to say, hey, I want to ask a question, and then we can engage with a live question if that's something that you'd like to do. All right. Next, please, Nikki. Thank you. All right. So let's jump into things. If you can keep going, Nikki. So as I have talked to groups all across the country, and I talked to them about sort of what are the challenges that they're experiencing, which I imagine a lot of this is going to resonate with all of you. And these are the four sort of big things that come up to me. The first one is that, if you think back and if you look at me, you can probably tell I've been doing this for a while. And I think back to my early days in healthcare IT when, all we have is practice management systems, right? Then EMRs came along and patient portals and EDI and et cetera, right? And there's all these different systems that many of you have to sort of figure out, do I want this system? Do I need this system? Can I afford this system? Which one should I get? How do I negotiate a contract? How do I make sure they're all integrated together and stay working together over time? And how do I afford all this, right? So there's a lot of overwhelming of I need all these third-party different things to sort of Frankenstein on to make work. And that's a challenge that many practices experience. The other day, I was presenting to a group of actually on our CSM team that was younger folks, let's just say, and it occurred to me that they may have never actually even seen a fax machine, and I thought of that because fax machines are still alive and well in healthcare, right? And so to the point of manual work is still a huge burden on your staff and your providers. All the things that they have to do, whether it's managing that fax machine and having to get results into the record where it needs to go, right? All these things get in the way of the things that they really want to do, what you really want to accomplish as an organization, providing great care and growing your business. To that token, we've been talking about burnout for the longest time here. Staff burnout from a lot of the things we just talked about and all the work that they have to do, and providers. And let's be clear, docs, generally speaking, all providers really don't like their EMRs, right? It gets in the way of that one-on-one conversation they want to have with their patients. That's what they really want to do. And between that and all the work they have to do in their pajamas at night, et cetera, causes a lot of burnout from providers and staff. And then lastly, you're getting squeezed, really in three different directions, right? You're getting downward pressure on reimbursement that continues. You're getting upward pressure on costs. It's a really bad math equation right there when those are going towards each other. And then sort of there's that hangover, I guess I'll call it, from COVID with staffing, right? Where many of you still struggle to hire and retain really good staff. And so these four things are the things that I hear a lot about that are going on throughout healthcare across the country. And they're things that athenaOne can really address. So let's talk about those for a second here. Thank you, Nikki. So the beauty of athenaOne is that it is a single system. Now, I'm not trying to say that it's everything that you could possibly ever want, but it's the core things that you need and do all contained in a single system. There's the revenue cycle, obviously, the EMR, the clinical experience, and then also patient engagement, right? All in a single system, developed to be a single system. And by the way, in a SaaS-based platform, and when we say that, it's a term that gets, I'm going to call it misused, same as cloud-based gets misused. In fact, I often think that when new technologies come along, vendors become what I call buzzword compliant, right? Their product doesn't necessarily change, but what they call their product or how they call their product does change over time, right? But athenaOne is a truly, single instance multi-tenant platform where everybody's on the same instance of software. You don't have to worry about upgrades. You're always current, et cetera, et cetera. So it's a huge advantage to that. And the fact that it's all within one system, all three of these components. Next, Nikki. Thanks. All right. So I'm going to ask a provocative question here for you that you may wonder why the heck I'm asking this, which is, should LeBron James mow his own lawn? Now, the reason I'm asking this is because it talks about an economic principle that I think is really important, something called comparative advantage. So this, by the way, is actually LeBron James. He is on a lawnmower with some commercial that he was in. And so the hypothetical here is LeBron mows his lawn. He's good at it and he likes to do it. And he could do it, his ginormous estate, in, let's say, an hour, right? But his other option is he could hire little Susie down the street to mow the lawn. Now, she doesn't do it as fast as LeBron. It takes her 2 hours, and she charges LeBron $20 an hour. So it's going to cost him $40 to have Susie mow the lawn. Now, if I were to ask my 96-year-old father who grew up in the Depression which option he should go with, he would, of course, say that he should mow his own lawn and keep the $40. But if you think about this a little more carefully, what are LeBron's comparative advantages in life here, or in how he earns a living, if you will, right? He is obviously one of the greatest basketball players of all time, and he's also a celebrity. So instead of taking that hour to mow his lawn and save the $40, he could be making a Nike commercial, let's say, and pocketing $1 million. He could be honing his skills as a basketball player, because at this rate, I think he's going to play forever, right? And so he could get a better contract in the future. So the whole point is he can focus on what his comparative advantage is and let Susie mow the lawn in the same way that we, as with athenaOne, want you all to focus on your comparative advantage, what's important to you, your vision, your mission, et cetera, what differentiates you out there, and let us mow your lawn, if you will, by taking up some of the work that isn't focused, isn't necessary to you being successful. All right, go next, Nikki, please. So by now you're probably thinking, let's see, we're about 4 minutes into this or so. I think a little bit more than that, a few more minutes into this, and you're wondering, wow, he finally brought up AI. And probably every presentation you're seeing today that has anything to do with technology probably starts with AI, right? And the reason for that is AI is, to me, we look at AI in a much more holistic way. Again, everybody talks about, AI-powered EMRs. It's the same EMR they had. They just, are calling it something different to some degree. We've been doing AI, quite frankly, for over a decade, right? That whole thing I was talking about with document management, we've been taking over documents, managing documents for our customers for over a decade, taking those documents and making them electronic and putting them in the chart for the person and using technology to do that. And for sure, with the advances of AI that are happening right now, this is going to accelerate dramatically over the next year to two and beyond. So we think of using AI more as a tool than as a sort of a of a product, if you will. So we use AI to help create greater efficiencies, like those document management as an example I gave you, and reduce work of your staff. We use AI to help provide better information at the right place for your staff. We use it to enhance the experience for your docs, your providers, and your staff, as well as your patients, which is really important. And then, of course, for revenue enhancement, we've had a rules engine for more than 2 decades right now that helps our customers ensure that they reduce denials as much as possible. And AI is one of these things that's going to fit like hand in glove in terms of what we're going to be doing and accelerating our ability to automate that process going forward. Next, please, Nikki. And so just sort of putting it together in terms of AI, really what we're focused on is, transforming that revenue cycle to improve the quality, but also reduce your work. Our Chief Product Officer, Paul Bryant, he tracks the work that our customers do versus the work that we do, et cetera. He has very specific goals about reducing that work of our customers and getting it down as close as he can to zero. Again, we want to delight clinicians, get back to the point of where you can, walk into a room and just have a conversation with a patient and really focus on their care, not have to focus on something else. And again, delighting patients, that stickiness with patients is really important. And they're all used to, using their phones, if you can see mine here, to do just about everything. And that's an example of the capabilities you need to be able to present to them to keep them close to you and sticky and remain as patients. Next one, please. And so last thing for me before I turn things over to Ken is, again, I want to thank everybody for being a customer. And because you're a customer, we put together a program. It's one of the things I do and manage here is to make sure that if you want to make that move to athenaOne, we're going to make it as easy as we possibly can for you. So first of all, we would provide pricing to you that's sub-market that we would not provide to anyone who is not a customer. Secondly, we do everything we can to lower those transition costs. We know that no matter what, whether it's the check you're writing potentially for certain things in a transition, or the fact that you maybe have to reduce staff for a little bit, or just generally all the work that goes into moving to a new system, there's some costs involved. So we do everything we can to sort of reduce those costs from us to make it really simple for you, and easier, I should say, to move on to athenaOne. And because these are both of our systems, we know both systems well. We know the data really well. We've gotten really, really good at moving the data from one system to the other that makes sure that we get that data across and can do it in a more efficient and effective way.